All right, if everybody's ready, we should probably go ahead and get started. I'm Garen Wade, the chair for this year with the police department. Go ahead and start with introductions, I guess.
So I'm Adrian Beck with the Missoula Office of Emergency Management, and I would like to make just a couple quick introductions. We've had some changes within our staff, and so I'll ask some of my new folks to raise their hand who will have some role of participation in this meeting. Shiloh Lucier is our new administrative assistant within the Office of Emergency Management. This is day 4 for her, so still learning the ropes. And then Max Rebholz is our new Community Wildfire Preparedness Coordinator, and this is his first day. So please, as you're walking out or mingling after the meeting, make an opportunity to introduce yourself. Also, I want to advise everyone that this meeting is being recorded by Missoula Community Access Television as part of a media assistance grant donated to Missoula County, and so we're very pleased to have their participation in this and being able to broadcast our LEPC out to the community. The event will be aired on MCAT channel 189 or 190 and can be downloaded to video on demand at a later date. So with that, when you are speaking, it is important for their recording audio that you do speak into the microphone. We do have some handheld microphones, so when we do introductions, don't be bashful, please speak into the mic.
I'm Gordy Hughes with the Missoula Fire Department, Vice Chair of the committee.
As promised.
Ray Nicholas, a hydrologist with the National Weather Service here in Missoula.
I'm Marty Whitmore with the Weather Service in Missoula.
I'm Ian Thigpen with State Department of Public Health and Human Services. I'm the State Mass Care Coordinator, also do crisis and emergency risk communications for public health emergencies.
Leah Hickey with the Missoula Health Department.
Lisa Timms, Missoula Health Department.
Raquel Smith, Community Emergency Response Team, Program Manager and Instructor.
Max Rebholz, Wildfire Preparedness Coordinator with the Office of Emergency Management.
Nick Holloway with Missoula County Emergency Management.
Shiloh Lucier, OEM Administrative Assistant.
Jackie Baldwin-LeClaire, American Red Cross Disaster Program Specialist.
Steve Davis, Red Cross, and also Ravalli County LEPC member at large.
Mike Kapiski, City Citizen Rep.
Roger LaFerrier, Rocky Mountain Labs, Hamilton, Montana, also a member of the LEPC down there.
Brenda Mark, Rocky Mountain Labs, Hamilton, Montana.
Malin Manson, Team Rubicon, Northwest Territories, Montana.
RJ Nelson, St. Patrick Hospital Emergency Management.
Diana Mineta, I'm the Energy Conservation and Sustainability Coordinator for the county.
Paul Finley, Missoula Rural Fire.
Joe Blattner with Missoula County Search and Rescue.
Rebecca Wallace with Missoula County Search and Rescue.
Angela Yance with Missoula Water.
Dee Strauss, Village Health and Rehab.
Ari Cornelius, Missoula Fire Department.
Jim Kitchen, Montana Highway Patrol.
Troy Monroe, Assistant City Engineer.
Jenny Ross, Community Medical Center, Trauma and Emergency Preparedness.
Russ Lawrence, Community Medical Emergency Preparedness Coordinator.
Dave Strohmeyer, Missoula County Commissioner.
Cobb Muller, Consumer Direct Care Network, Home Health and Hospice.
Heidi West, City Council.
Matt Jennings, Deputy County Attorney.
Lori Dove, Monroe County DES.
Judy Douglas, Missoula Aging Services Senior Corps Volunteer Program.
Chris Fink, CHS Pipelines and Terminals.
Rick Nelson, Maintenance Safety Director for the Goodman Group.
Eric Legvold, United Way.
Kay Altenhofen, Environmental Health and Risk Management at the University of Montana.
Ken Parks, Office of Emergency Management for the county.
All right, thank everybody. If everybody's had a chance to look at the minutes, do we have a motion to approve?
Mr. Chair, I will point out that the minutes that are available on the back table reflect a change that was made to the electronic copy that was sent out to folks 2 weeks ago. If you'll look on page 2, it is in track changes. It's just a clarification to the wording around there.
With those changes in mind, does anybody have a motion? All in favor? All right. Go ahead and move on to community or public comment. Do we have any public comment at this time? Seeing none, how about community preparedness presentation?
So, Mr. Chair, you will note that the agenda that's out today is for mass casualty incident anonymous patient tracking. RJ from St. Pat's punted for us because we did have a change to the agenda, so we appreciate his willingness to come and talk about this topic.
Either one? How's that? Well, good afternoon. I'm RJ Nelson from St. Patrick Hospital Emergency Management. And I wanted to kind of throw out a project that I've been working on from the hospital standpoint to this group, having a little bit of difficulty getting traction within our hospital system for it. I think it's mostly an education issue. When we talk about marketing and web development, it's not necessarily the people that are familiar with emergency management or disaster response. And my daughter here, Gracie, is homesick from preschool today, so she's on my hip. We're inseparable today. But I wanted to address specifically the law enforcement and county folks in the room, and I'm glad that community's got some representation here too, because this is something that could really benefit everybody. So statement of the problem. You look at after action reports for different mass casualty, specifically active shooter, mass shooting events across the country, and you'll see some common themes in receiving patients at the hospital that are unidentified. Really don't have a good way of knowing who they are, medical history, family contacts, things like that. Highlighting that is the Pulse nightclub shooting in Orlando a few years ago. I think it took them almost a week to finally identify all of the patients that they had intubated, post-surgical in their intensive care unit. So, that being said, we've followed a lot of these, and it's becoming glaringly obvious that we need a method to identify folks that we receive at the hospital that really can't talk for themselves, and we don't have any contact information for family, no identification, things like that. Orlando Health, the level 1 trauma facility that's about 2 blocks from the Pulse nightclub, tried to get a waiver in order to violate some of the HIPAA regulations. So that's the Health Insurance Portability and Accountability Act. So that being said, the government said absolutely resoundingly, no, you can't post pictures or information, identifying information about patients in order to have the community then help you to identify who they are. However, you can receive information. So what Orlando did, Orlando Health, is they just put a website together, fairly simple, that allowed the public to upload names, descriptions, pictures, in order for the hospital and law enforcement to use to be able to identify those that they had in their hospital that they didn't know who they were. Is everybody following me so far? Okay, hold on, I'm going to switch. No, I'm good. I think I better keep moving or we'll get antsy. So what you see in front of me here is just a Word document that I threw together to kind of give an idea to a web developer within our hospital system to say, hey, can we put a web page together that somebody can go in and submit a data form, submit some pictures, help us identify these folks. Again, didn't gain a lot of traction because all our web development goes through the marketing department. and I think I was speaking to the wrong audience maybe. But after looking at it a little bit more, this is actually a partnership to identify these folks between law enforcement and healthcare. So having it maybe government-based through the county, I think actually makes more sense, and would be able to be accessed in a partnership between the police department, sheriff's department, whatever the jurisdiction is, and our healthcare folks. So my ask of this group is input into this, and then maybe some support to go to Missoula County and say, do we have some resources to maybe put together a fairly simple web page that would only appear on a county website or a link from the hospital websites in the event that we needed it for a drill or a real event. If you want to, is there any way you can kind of scroll through? And Garrett, this is, I mean, why reinvent the wheel? I basically went to the Center for Missing and Exploited Children and kind of looked at the information that they had that you could upload and copied it. I didn't actually give them a footnote, so I may have stolen it, fair and square. And I would also like for the city and the county, you know, law enforcement to actually have some input into what this looks like and what information is going to be helpful for them. So I guess with that, my other arm's now tired. I would just ask for input, thoughts, ideas, better mousetrap. You know, community, you got anything, Jen, to add on this? Okay, I can't give you all the microphones at once. You have to go one at a time. Relax. Any other input, ideas, thoughts? We can talk after. Maybe, if I'm still here. Garen, you got anything on this?
No, I don't think it would be hard to put something like that together, even on short notice. It seems like we were doing the same thing during the floods to get information and allow people to submit photographs, videos, and other information of damage that was actively occurring. So it didn't take any time to get that done.
We just need a 13-year-old kid who can develop this for us, basically.
Yeah, I would say that, RJ, certainly our office would be interested in carrying this ball forward, and really, I don't think that this is a heavy lift or a heavy ask. We have the capabilities today to stand something like this up, but I think your idea of having this kind of constantly available and in the background that we can just turn on or share the link at a time of need is very appropriate, so.
And for healthcare agencies, this is going to be a joint commission and CMS requirement as well. So, all right, thanks for your time.
Thank you. How about National Weather Service update?
Want the internet or anything?
No, I didn't grab anything. So, hi, Marty Whitmore with the National Weather Service. Just kind of recapping since we met last, I think it was early July. Is that right? So, if you remember, we stayed pretty wet around west central Montana through June. But when we met last time, the faucet had just kind of shut off, and we set a record of days without rain at 47 here in Missoula, which broke the record that was just set the year before. So wondering why we didn't have maybe as big a fire season right in west central Montana as other places. It's kind of interesting. You look at Kalispell up in that area, their faucet shut off in early June. So the time of the year when they should be getting the most precipitation, they went dry, and then they had the same extended dry period that we did. So just that little bit of difference, they had numerous project or larger fires up there. None of them got huge, you know, but there were several in the 12,000 acre stuff. And we had a lot of incident meteorologists deployed up there with some of the Type 1 teams that we were supporting here in west central Montana. And it might go into the next topic with the review of the fire season, but it seems like we were able to catch more of the fires down through here and down through the Bitterroot. Then you got down into southwest Montana, where they also had more of a precip deficit in June versus what we all had in July and August, and they also had some bigger fires down there, and even worse so down in southeast Idaho. So it's really amazing, what one maybe 2 or 3 week period of rain or lack thereof can do to a fire season. In the end, for the water year, Missoula, which is October to October, here in Missoula, we ended up just slightly above normal, where Kalispell was a little bit below normal, but there's only a 1/4 inch of difference between the areas, and it made a huge difference in amount of fire activity that they had up there. So I thought that was interesting. I can see by the face, I might be the only one who thinks that's interesting in the crowd, but I had to come up with something for this topic, right? And we did have some heat, not the extreme heat we had in 2017, but we did hit 104 degrees here in Missoula, which is pretty rarefied air. The all-time record's 107, so that's pretty rare to get up in the over 100 and 104, extremely so. Anyway, we've had 2 La Nina winters, which have made pretty good snowpacks in the mountains. Well, La Nina's gone, and we're headed into El Nino, which tends to be a pretty poor snowpack situation for the mountains. And sure enough, the forecast, if you look forward December, January, February, they really have a bullseye of Montana for being below normal precipitation. It's harder to really gauge El Nino as a predictor for the valleys, because the El Nino winters can be pretty messy at times down here. In fact, sometimes we go in and out of the warm and cold air. So we start to worry about maybe more freezing rain events down here in the valleys. And so overall, down here, we could be just as active. You just never know. But the mountains, it's really tough to get an above normal snowpack in El Nino. You might get normal, but generally it's below normal. So probably next time we meet, we'll have a better feel for that, but we'll start already looking at water supply in the spring and drought conditions and things like that. So we'll see. So any questions? Thanks.
All right, thank you. How about a 2018 fire season review? Who's doing that?
Well, as Marty indicated, there's not much to report. We felt like we kind of dodged a bullet here this season because the conditions certainly were there. We were just lacking any of the starts, and fortunately, we had severity resources in the area that were able to stomp on any fires that did start and keep them very small. So, and from an air quality standpoint, we actually fared pretty well. And of course, everything is well in comparison to 2017. But we only had just a handful of days that we had bad air. But the environmental folks over at the Health Department and Climate Smart Missoula have been working on kind of a smoke adaptation plan for Missoula County, as well as they continue to distribute the HEPA air filters to the vulnerable populations, and did that throughout the summer very successfully. So. Nothing really to report for 2018 fire season. Our incident management team did not actually take an assignment this summer, but individually, lots of folks did get out on fires to complete task book and position work.
Okay, I think emergency operation plan update, Ken?
Okay, here we go. So we are getting out the emergency operation plan. We're dusting it off. We're going to give it an update, go over the different annexes and the different names that are in there, and be sure we've got everything current and up to date. We're looking at within the next few months, hopefully we'll be able to email some copies to you guys that have been identified as players in those plans, and you guys will get a chance to look at it and see if it's still relevant to your organization. If there's been any changes in your organization that needs to be updated to the plan, then we'll be able to go through those changes. Not anticipating there's going to be a lot in there that's going to need changed. It's more of an update as described. So I don't think it'll be a heavy lift for everyone, just more of a going over what we have and being sure it's still relevant and up to date. If you have any questions, please hit me with an email. If you've noticed anything out there that you think is out of date and you want to point it out to me, please send it my way. Thanks.
Okay, what do we have next? Flood update, review?
I hope we're not flooding anymore. So this is just kind of a status update of where we stand in our efforts for recovery from the 2018 flood season. At our last LEPC meeting, we talked about we had just come out of flooding and we're in full-on recovery mode. We still are. There are still some significant impacts to citizens and infrastructure, private infrastructure that was damaged during the flood season. You may have followed the news. The state of Montana did request a presidential disaster declaration for statewide flooding in the state of Montana. FEMA did authorize that presidential disaster declaration, but they set a date specific that excluded Missoula County and 5 other counties with that declaration. So we have asked FEMA to kind of take a second look at those 6 counties that were excluded from that original presidential disaster declaration request. And they have done that. They feel that there is substantial damage enough to warrant a second request. My understanding is that the state has issued an appeal for a second request of a presidential disaster declaration. We have not heard anything on that yet and likely won't for some time. If that second presidential disaster declaration is successful, that will allocate funding for mitigation-specific projects that we will not have to compete necessarily for. We'll compete with the other counties that have the declaration, but we won't be competing statewide. We won't be competing, nationally for that money, though it is a relatively small amount of money. We are also right now in the process of gathering intel and information to submit a pre-disaster mitigation grant. This is one that is nationally competitive. There's about $233 million available nationally for pre-disaster mitigation projects. This would allow us, if we were successful, to hopefully acquire and buy out those homes that are repetitive loss or that will be repetitive loss based on new channel migration and flood impacts that we've seen. So more to come on that, but that's kind of where we stand with flood recovery.
All right, emergency alerts. I guess that's you.
So in the period since our last meeting, our office has issued 4 emergency alerts. One for an armed and dangerous individual in a neighborhood that had been involved in an assault. We issued 3 alerts concerning the 911 outage that occurred in August, and then we had an alert for a 6-year-old missing female that was located, and another one for a 7-year-old female that was located. On October 3rd, last week, FEMA and the FCC issued a national EAS and wireless emergency alert that went out under the Presidential Alerting Authority. We saw relatively spotty coverage of success here in Missoula, and I guess I would just ask by show of hands how many people received the alert on the 3rd on your cell phones. So anecdotally, that is kind of what we have been hearing as well, is that anywhere less than 50%, but about 25% success rate in the state of Montana. There are several reasons for that have been explained to us. Where's Nick? You want to cap that? No, I'm just kidding. They've given us some highly technical reasons as to why it may have failed. In eastern Montana specifically, some of the smaller carriers have opted out of transmitting those wireless emergency alerts, and that accounted for a significant portion of that population not receiving the alerts. But here in western Montana, Verizon, T-Mobile, AT&T, the big carriers have all opted into transmitting those alerts, and most of us have received Amber alerts, and so we know the system works. We're anxiously awaiting kind of the audit of that test from FEMA to see what possibly prevented those alerts from going through and correcting any of those issues, but this is why we do tests. So.
Okay, standing committee updates. I don't believe there's been any IMT meeting. Access and functional needs. Was there any activity?
Leah's coming up.
So Leah Hickey from the Health Department. We had an access and functional needs meeting last week, and our next meeting is January 3rd of next year at 10:30. If you aren't on the distribution list and you would like to be on the distribution list for the meeting, it's a really helpful meeting, especially when you're working on emergency plans and would like some networking or assistance in trying to include populations with access and functional needs. Just let me know and I can get you on the list at least. And then for the HEAT meeting, the Health Emergency Advisory Team, our next meeting is in 2 weeks, next Tuesday the 23rd at 9 a.m. at the Health Department. Same thing, if you'd like to be included on that meeting, just let me know.
Thank you. Upcoming trainings? Does anybody know of anything or aware of anything going on? Yeah. I waited till you got there.
The health department is planning, in coordination kind of with FCS, we're planning a measles tabletop, and it's going to be March 5th of next year. So I'm a little early in announcing it, but if you're interested in, I'm making a list now of people to invite. So if you're interested in being a part of it, just let me know also.
So, go.
Measles.
Salmonella is the topic for that one. So following the 2017 fire season, we reached out to the USDA Forest Service, who has a program called Community Mitigation Assistance to Communities. And so we requested what they affectionately refer to as a CMAT, Community Mitigation Assistance Team. We requested a deployment of that team to Missoula to talk through our mitigation strategies following a pretty horrific fire season and going forward into how we become better fire adapted here in Missoula. And certainly this is in Max's wheelhouse on day one, but the CMAT group will be here this week, the 11th and 12th, out in Frenchtown. We're doing a whole day workshop on both days to really talk through what our mitigation challenges are here in this valley, as well as opportunities and how we leverage those within our community to be more fire adapted and to get some mitigation work done. I'll also mention that we have a significant number of our normal players missing today because they are participating in a week-long Train the Trainer for active shooter type. Well, it's active shooter type, but it's integrated response between law enforcement and fire and EMS folks, so that we can kind of be on the what is the best practices for how to respond to these types of events for mass wounding or active shooter type events. Our office has secured a Homeland Security grant, which we mentioned last LEPC meeting, that is going to kind of fund training and equipment going forward. So there'll be a lot more of these types of trainings being offered throughout the community. But this week-long Train the Trainer course, I think they have about 30 folks from all the agencies that are participating in that will enable us to be able to provide it and be a lot more nimble in providing it in our community going forward.
Okay, multi-year training and exercise plan.
Nick, were you going to talk about that?
What's that?
The MTEP?
Sure. The MTAP is a multi-year training and exercise program we develop every year to help drive what we want to test, and we need to come together with a committee, a subcommittee, to decide what core capabilities from the FEMA, what is it, NIMS? From FEMA's NIMS document that we want to test as a community, and then we will look for trainings and develop exercises around those core capabilities. So this training and exercise program has been a rolling 3-year plan, and another thing we want to look at is whether to maintain a 3-year rolling plan or just do 1 year at a time. So we'll talk about that in the subcommittee. Traditionally, we've done the core capabilities we've looked at are public information and warning, operational coordination, operational communication,
And I think that's it for the last one, but we look at prioritizing 3 to 5 of those core capabilities. So look out for an invite to be part of that subcommittee and come to that, and let's decide together what we want to look for. Thanks.
All right, thank you. Hazmat incidents since our last meeting, and then also the statewide hazmat issue.
So last month, during our monthly hazmat training, we actually had a call out on that day shortly into the training endeavor at the university. There was a vial of chemical that was dropped and had an exposure to an individual there in the classroom. They called out the team, and a handful of techs showed up and mitigated the spill, and everything was taken care of, and it was a good exercise. Even though it was a small amount of chemical, it went very well. On the state level, we're gearing up for the next Homeland Security grant by looking at our deficiencies within the team's inventory. We received the trailers with the inventory, I believe that was in 07 or 08, on that timeline. And a lot of the equipment within those trailers are now aging. The bulk of the cost is going to be within the meds that are in the chem pack and a lot of the meds that we carry. So we're going to tackle that from a statewide perspective, so all the teams are back in compliance based on the state's hazmat plan with the equipment that is in those rigs. Other than that, that's hazmat.
All right, thanks. Round table and other business.
Play game show host.
I think I shared everything.
I think further back.
This is Roger. Just a reminder, October 18th is the Great American Shakeout, and Montana's participating in that. So at 10:18, make sure you drop, cover, and hold on.
Hi, I'll introduce myself again. I'm Diana Mineta, the Energy Conservation and Sustainability Coordinator for the county, and Adrian asked me to come and let you all know about a new planning process that we're undertaking, the county in partnership with the city and a local nonprofit called Climate Smart Missoula, and this is climate resiliency planning for the county as a whole. It'll involve taking a look at our locally specific climate forecasts. So what are we expecting in terms of changes in temperature and precipitation in the coming decades? And what does that mean for fire, for flooding, for agriculture, for recreation and tourism and health and other sectors, looking at our greatest vulnerabilities and strategies to address those. So our intention is to look to and build on all the work that's already been done in this area. So we're looking at the pre-disaster mitigation plan, the community wildfire protection plan, and other resources. And Adrian is on our steering committee, but I hope that you all will engage. There will be plenty of opportunities to engage throughout this process, and you all are going to be really important and bring an important perspective to this topic. So thank you.
Don't make me start calling people out that I know have things to say. Jackie, you want to talk about what's going on in Iowa?
So our National Division, which is Montana and Idaho are part of, they're hosting, so in Iowa, at the end of this month, I believe, or beginning of November, can't remember the exact date, our division, which is made up of all the Midwest states and then includes Idaho and Montana kind of tacked on at the end, they're hosting a convention, and they're inviting emergency management both from state and local. And so we invited emergency management, and Nick Holloway was kind enough to consent to attend. So they're just bringing together partners to see how Red Cross and partners can work together. They might be addressing partnership with other organizations. They're going to bring in some speakers and try to just learn how we as a nonprofit can help support those communities at the state level and locally, and then how we can all work together.
The exact date is Halloween.
Oh, Halloween. That's the exact date. So thanks for skipping Halloween, Nick.
He won't be haunting the house.
Yeah. Good.
Going once? All right.
Does anybody have anything else? Adrian, you have anything else?
I normally, want to have the last word, but I don't think I have much to say today, other than, thank you very much for coming out today on a gloomy, October day. This is a great attendance for a lot of stuff going on this week and this month, and so we very much appreciate and value your participation. So, thank you, everybody.
All right, we'll go ahead and adjourn. Thank you.